yeah, I call AI a divine tool for us because it can make a life a lot easier for us in
We
many
don't know
ways.
what we don't know, but being in conferences where we're being pushed to another level, different perspective of different people around the world really makes us a better
Using
individual.
AI as a business for internal efficiency, but using AI as a marketing tool.
You don't need 100,000 people you need 10 loyal people around you that have a similar vision.
Three dental people that you would say that, you know what, you cannot. Good morning, everyone. Extremely excited about our today's guest, my good friend, Dr. Shah, who basically leads entrepreneurship in dental. And he's going to talk about an amazing conference that he's working hard on, 2026 Global Medical Dental AI Summit. So, Dr. Shah, first tell me your journey from entrepreneurship to this, and then tell me the story of you and how did we come up to your final beautiful, amazing conference that we are all excited about.
Thank you for having me on the show, Junaid. I'm a dentist, focused my practice here in Southern California. I'm in my 20th year of clinical practice. Focuses on dental implantology and oral surgery procedures, but we do everything from A to Z in a dental setting. We have a host of GPs and specialists on staff. It's a very successful practice where we focus on patient satisfaction, utilizing AI to reduce overall burden and focusing more on the patients. Personally, I was born in Iran. I was raised in Germany, and for my undergrad and advanced educations and certifications, I came to the United States. So 30 years later, after undergrad and postgrad, I took a keen liking on the business side of things and the healthcare industry. How did we arrive at this conference? I'm the founder of the founding regents of the Global Summits Institute, which is a consortium of high-performing doctors from around the world with the goal to maximize partnerships and relationships between doctors from a financial, administrative, and academic three-pronged approach to restore order and essentially what's a broken healthcare system around the world. And our contention is that only doctors can fix it. Out of that group, just as an analogy, they put 100 scientists in a room and they came out with an atomic bomb. The idea was, how can we bring in 100 very smart doctors into a room and figure out how to fix all this utilizing advanced technologies? Out of that group, we started the doctor-to-doctor movement about 15 years ago. And today it's spanning about 163 countries. The idea is to bring doctors together and write the standards and governments and advocacy and policy and things of that sort for the AI industry to create some kind of boundary and guidelines for our colleagues. Out of these rooms come the ideas to put an event together. Every other year we do a Doctors World Gala in Italy, where it all started with the Romans there. And then people ask me, you call it the divine tool. And yeah, I call AI a divine tool for us because it can make a life a lot easier for us in many ways. So that's how we got here.
Amazing story. And again, people see that this conference came about, as he suggested, Dr. Shah. It took 15 to 20 years. So Harvey, I'm going to start with you. Building a personal persona journey for entrepreneurship. How did you do it? And then ask Dr. Shah how he did it, so that other providers who are jumping into this field of entrepreneurship can actually do this, and then link it back to how important it is to join these conferences.
Awesome, guys. Thanks for thanks for coming, Dr. Shah. So for me personally, I really think when you're an entrepreneur, you need to hone into what is your passion, what drives you, what's going to keep you up at night, in the sense that we're all going to start with our day job, right? And we have to balance, and something may have to give. And sometimes it may be some time with family, sometimes for our personal. So number one is find your passion, let it drive you. And then what do you stand for? And for me, my passion is AI in healthcare. How can I help patients? Now I'm the chief AI officer for a space company, and I've started over 40 companies. But the big picture about it is go with your passion. So, Dr. Shah, I'd love to hear your story.
Persistence, determination, focus is what I would say are the three things. When you play at this level, a lot of people have opinions about you. But if you want to achieve what you want to achieve, you got to do what you have to do today to be where you want to be in 5 years. So it takes a lot of determination and persistence to get to where you need to be, irrelevant of what optimists or pessimists think about your ideas and concepts. So it's very prudent to be persistent, determined, and you will achieve your goals. You have to surround yourself with the right people. You don't need 100,000 people you need 10 loyal people around you to have a similar vision to take over the world. But there's been a lot of failures, Harvey, too. With failures comes success. If you don't know how to fail, you don't know how to succeed.
So tell me why you became a speaker, why you're so excited about it that you called me and said you have to come to London and everything. So just put that picture for our audiences that why this first for you, and then Dr. Shah, same question to you is why should I attend it? Let's just be honest.
At the end of the day, it's a rare occurrence to be able to have so many amazing leaders in the same place. And to that effect, knowing that so many amazing people are going to be there, the meeting of the minds, and it's also about growth for me personally. We don't know what we don't know, but being in conferences where we're being pushed to another level, different perspective of different people around the world really makes us a better individual.
I hear the sentiment that the medical doctor doesn't want to hear what the dentist has to say, and the dentist doesn't want to see what the medical doctor has to say, but this is a bad marriage. And with predictive analysis now, the dentists are going to be your best friends. So dentists and medical doctors really need to integrate now and create a much better. It's our duty as doctors to utilize the tools that are available in the marketplace to improve the quality of patient life, regardless of our personal opinions and lack of action thereof. You have to seek these solutions. Now, the medical doctors know things that we don't know, and we know things that you guys don't know. So the purpose of this event is to come together, join arms, create a better, more synchronized environment, and figure out this behemoth that's possibly smarter than anything we have seen in human history before it outmaneuvers us. And there's going to be all sorts of different programs and other things going on in other rooms that are not just clinical. For example, just if you ask 10 doctors, we all live the same lives. We got to get out of our silos, meet, and start taking back what is our industry. So there's going to be a lot of ideas, a lot of capital, a lot of bold ideas. Hence, 100 speakers, 3 days, high-level networking, and it needs to happen because no one else is doing it. The bridge between medicine and dentistry and across the board of healthcare. That's why we're doing this. So a lot of good stuff is about to happen in healthcare, and I'm very excited about it.
That is so important. I'm going to come back to that point. Using AI as a business for internal efficiency, but using AI as a marketing tool. And Ed talks about it again a lot. And as we are moving towards cash-based concierge medicine, this is going to become extremely important as a business. And we need to understand that it is a business too. Before we go into more further, I know this is the website, and then you can buy tickets. And then with the grace of my friend, Dr. Shah, for this audience, he has given us a discount code that is VIP20. Is that correct, Dr. Shah?
That's correct. It would be very honored to have you guys join us there with that VIP 20 code.
So now, first of all, tell me about this beautiful hotel that you were telling me about personally. And then tell me about that I should come 2 days early and stay later. And what should we not only expect in terms of this conference, but make it a family vacation too?
The Leonardo Royale Hotel in London, and if you click the venue tab, there's a 3D rendition that you can walk through the hotel. The idea was to find a facility there because we're talking about dentistry and medicine bridge. There's a lot of activities there by the river and lots of nice dining and fun. And it's also, this is a 15-minute TED Talks. We want to have 100 guys come in and talk about exactly what they're doing and with quick, concise, precise objectives. So there, you're going to have 3 days of intense networking. It's not like your big conference where you go and 50,000 people are coming there and you have a little booth and you're sitting there praying that somebody's going to walk by your booth to talk to you. It's going to be 3 days of hardcore closed door networking between the leadership of our industries to come up with solutions, maximize our professional endeavors, as well as make new lifelong friends.
I'm very excited to learn from all of these people that is coming here to this conference, and I'm just super super excited. And then they have a proper dental track, so I love that, because there is a dental track which I will be mostly attending, by the way. And then then there's a medical track where people are going to talk about medical stuff.
Yeah, and I'll plant another seed, Dr. Shah, that you don't know. I've been helping a company now for about over a year, creating a RAG model for a oral swab. And then the oral swab does, and as you know, looking for different pathogens. And then depending on those pathogens, you may get a rejection of, some of the grafts that you're doing, or as you know, all these other diseases. But how do you treat that? The medical
Smart.
world doesn't know how to treat that. So we created a RAG model that you submit the swab, it gives it a spit out of what protocol you should try, and something kind of neat that we're doing. So just wanted to share.
What I would say to that is, if you have an ability to connect that with systemic problems to come and predictive analysis, I would implement that and connect the two.
Harvey, what are you going to talk about?
I don't know. I really want to chat with you about what you want. My favorite phrase is work backwards. What's needed? I'm biased in that I'm working for a space company, and I really want to talk about how can we leverage the satellites, AI, and data centers for healthcare on the planet. But that's just one idea.
So, Dr. Shah, three
Lots of
amazing
fun stuff.
speakers that other than us, of course, we're amazing. But what I'm saying is, other than us, three medical people, three dental people that you would say that, you know what, you cannot miss. Of course, everyone's important, by the way, and I showed you the whole speaker list. I do not want to discount anyone, and especially you should join the AI. But let me ask you personally, of course, I'm going to be there for your talk. By the way, what are you going to talk about? And then what are you most excited about? Don't use the speaker names, just the topics that you know of.
There is certainly, I will be talking about a roadmap on how for dentists to get started with AI, regardless of the level of expertise they're currently in, because that's a very important question that's not being answered. They're all sitting back and waiting for next generation softwares to come out. And integration has been a big issue. I want to address that in my presentation, how to get around inter-platform integrations. But there's a gentleman that's the VP of the Red Cross across the world. He's got a very interesting discussion. There's a gentleman talking about public health solutions with AI. There's a lady that's talking about wound healing, which is actually very interesting of what AI is doing there. There's stem cell lectures going on regarding AI and stem cells and genomes and things of that sort. Then there is on the medical side, on the dental side, you have a wide array. It really depends on what you're into. There's going to be hundreds of billions of dollars in those rooms. If you're a doctor and you want to advance your career, one out of those 700 potential people, shaking hands with them and making friends could completely change the trajectory of your entire career. I leave you with this thought. There's 30 million doctors running around the world. There's a fraction of us united, less than 1%. It would be the most powerful entity with the most assets and the most respect from the public in the world. 0.5%. That's all it's going to take. Thank you.
Beautiful city of London in a beautiful weather at that time, but it is truly well timed for when it is so important, because that's my opinion, and I want Harvey's and Dr. Shah's opinion on it, that there's only 5 years left to make money with AI. Thoughts on that, Harvey and Dr. Shah? Is that a correct assessment? Because then winner take all, because I mean, it's going to be a little harder.
Yeah, unfortunately, I was having this conversation with my son actually over the weekend. He was telling me he had a 15-year plan, and I told him nobody. Shrink that down to 3 to 5 years at best, and then and that's to your point. I feel like that's the case. And if anything, he did a Shark Tank with him, his best friend with me. He's like, "Hey, Dad, I got this idea," and I was impressed. It was actually pretty good. But then I told him why it would fail and why it needed to be fixed. What I think is going to happen is, yes, we will have new industry, but the problem is there'll be a gap. We'll lose jobs faster than we will create them, and in that gap is what I'm worried about. And that's where I'm glad that we're having
And
these leadership talks.
so two things, Dr. Shah. Number one, is that really 5 years left? And number two, do you agree with his assessment, dystopia before euphoria?
I would say 100% I agree with him. AI is not going to take our jobs. There's new industries that are going to be created AI, which are going to create more jobs. There will be a gap, and it's going to plateau out the opportunities less than 3 to 5 years, which means just like the internet boom and the cell phone boom and all those things that we saw come across in our lifetimes, this is another boom, and there's going to be a bust. And when the time comes and it all levels out and the opportunities disappear, all those pessimists are going to be, when you look at the internet, you drop the internet today, they couldn't go back to the quality of life of the 60s. AI is here to stay. Those smart ones are going to use it to outcompete the ones that are sitting around and are scared or waiting or pessimistic about the situation. It's the hottest topic out there. It is here to stay. Next 3-5 years, we're going to create the first trillionaires in the world that are going to come out knowing how to utilize AI to improve qualities, which we have never had before. So yes, that assessment is about right spot on.
You've already mentioned a lot of these things, but I want to hear from you, Dr. Shah. What are some top things that come to mind for this conference for you? Like, hey, I want X, and this is, share what that is. What is it that you're like, oh man, this makes me excited about this conference?
My excitement is at a much higher level than just any of those programs as combined. As an objective for my doctor to doctor movement, this what I call a divine tool has finally given us something that we haven't had for thousands of years, where this connection was necessary between doctors. It has brought it to the table, an opportunity to level the field between one doctor and the world of profiteers and third parties and everything else. It's an amazing thing for me to have that comradeship. You gotta give them abilities to exert their voice and have the ability to network, truthful, meaningful network. So and it's grown. I have this is my passion, my life's work, but to bring doctors together. So for me, something like this couldn't be a better outcome. But a lot of perks will come out of it. There's going to be more lifelong relationships that I'm going to make there. So those are my objectives.
Again, reminder that these people, both of them, I mean, way higher in terms of, in terms of progress. I'm following a little in their footsteps and learning from them. So good. So again, I would like to close this podcast today. I'm so excited about this conference too personally now and learned a lot about it. I'm grateful for Dr. Shah to help us with our audience as well. I truly believe that 5 years are left. Physicians need to play a role as a stakeholder and then be part and parcel. Thank you so much, everyone. Have a nice day.